Pulpotomy is a procedure which is frequently performed in symptomatic deciduous teeth. It has a high success rate. In this procedure, partial or complete removal of coronal pulp tissue is done, which is followed by placement of a calcium containing material on top of the amputated pulp tissue. It is then sealed with a permanent restorative material and preferably a stainless steel crown. But in case of a permanent tooth, whenever it becomes symptomatic, instead of attempting a pulpotomy procedure or a direct pulp capping procedure, we always go for root canal treatment. Of course, root canal treatment has a very predictable success rate, but the problem is it does not maintain the vitality of the tooth, and because we do root canal treatment, the tooth undergo a lot of structural and functional damage in the future. These vital pulp therapy procedures are always performed in permanent teeth which are asymptomatic. But why not we try the vital pulp therapies even in permanent teeth which are symptomatic? Researchers have attempted doing this type of procedures in symptomatic permanent teeth in the past, but they always ended up with failure. Root canal treatment was providing a high success rate, and so this vital pulp therapy procedures in symptomatic permanent tooth was obsolete and no one bothered to do it. This could be attributed to the materials which are used for pulp capping in the past. Calcium hydroxide was the only material which was available and which was proven successful. But today, there are so many materials have been marketed and are available. That includes mineral trioxide aggregate, biodentin, calcium enrichment mixture, and so on. With the advancement of these materials, so many researchers have been carried out doing direct pulp capping, partial pulpotomies, and complete pulpotomies in permanent teeth which are symptomatic. At first, these treatments were attempted in young permanent tooth which are having open apex, but later these treatments were done even in permanent tooth with closed apex. The procedure is not very complicated. After rubber dam isolation, whenever there is a deep caries and pulp shows mild inflammation, that is, the patient is having symptoms, with the help of a sterile burr, the caries was excavated and the pulpal tissue was removed from the coronal portion of the tooth. It is then sealed with a biocompatible material like MTA, biodentin, CEM or a similar material. On top of that, it is sealed with a glass ionomer restoration. Follow-up evaluation have to be performed, and in most cases, the tooth was found to be asymptomatic and even it maintains the vitality. The tooth gives positive result to the pulp vitality testing, but the results are highly promising. Pulpal regeneration is proving to be a promising treatment in one side, but the other side, pulpotomy procedure in permanent symptomatic teeth are also proving highly promising. So these could be the treatments that will be revolutionizing the future of dental practice. Subscribe to my channel. Thank you for watching.